Tuberculosis has ravaged Ukraine and much of Eastern Europe since the fall of the Soviet Union. Treatment systems that were modern in the 1970s and 80s persist unchanged into the 21st century. In Kyiv, however, there have been efforts to modernize the ailing and often unreliable medical system. At the Children's Hospital Okhmadet in central Kyiv, the United Nations Children's Fund, partnered with the American Chamber of Commerce, presented a new $30,000 diagnostic machine. Early detection is key in curing and stopping the disease.
This is extremely important because, as you all know and you can imagine, the earlier we detect the disease, the earlier we can and the health professional can immediately provide the needed treatment.
One unfortunate consequence of Ukraine's healthcare system is the lack of money for new technologies and equipment. While Ukrainian doctors are often highly trained, they also have to rely on old and outdated methods. The diagnostic machine was donated as part of an annual charity program run by the American Chamber of Commerce.
Our members are able to donate funds, and the accumulated funds that were donated today, we had the opportunity to donate $30,000 American through UNICEF to the Children's Hospital Okhmadet to buy this rapid diagnosis equipment for children, especially for tuberculosis, which is a big issue in Ukraine. So the importance is to diagnose as soon as possible.
Many new cases of tuberculosis in Ukraine most often occur amongst children. It is also often paired with HIV, turning an already deadly disease into a twin epidemic. Tuberculosis is also evolving, and according to the World Health Organization, a quarter of new cases in 2016 were of drug-resistant tuberculosis, on which old methods completely failed to work. The cure rate for drug-resistant TB is a paltry 38%.
It is, unfortunately, according to the latest statistics, we have every year something like 40,000 new cases among the general population, so including children. So it is quite an alarming figure. The same is for HIV/AIDS. We have something like 2,500 new cases among children every year. So it is definitely an equipment like this is definitely needed, and we are very happy that we have partnered with the Okhmadet hospital to be able to accelerate, let's say, the diagnosis and the treatment process for many children.
Medical reform, currently on the Ukrainian parliament's legislative agenda, is a glimmer of hope on the horizon for Ukrainians and others who rely on the medical system. UNICEF sees the reform efforts as moving the oft-ignored problems of TB and HIV/AIDS in a positive direction.
The whole reform of the primary healthcare level is extremely important. We are very supportive and very, collaborating very closely with the Ministry of Health, particularly on the first level of medical care, the primary health care level. And so let's hope that, the reform moves ahead as planned, because it's a long-term process, of course, and many results have been achieved already, but much more needs to be done.
Medical reform does have its critics, who charge that the reform will lead to large-scale privatization and sell-off of often valuable land occupied by sprawling hospitals and clinics. However, there is broad consensus that the healthcare system needs to be fixed, and quickly. But until that happens, many hospitals in Ukraine, including Okhmadet, will continue to rely on donations by private organizations and NGOs to obtain desperately needed modern equipment.